name is Tesslah. I'm a student nurse, and today I'm going to be showing you how to administer a heparin infusion that is already prepared by the pharmacy, as well as do a chest tube dressing change. So I'm first going to start off with my heparin. It was already prepared for me, but I'm just going to do a first check here. So I've already checked my MAR and my doctor's orders together to make sure that my patient matches. My patient, their birthday, the medication, which is heparin, the route, which is IV continuous, the date, the time, the frequency, all match. So now I'm going to go into my patient's room. I've done just a general safety check. I'm going to introduce myself. So hi, my name is Tesslah. I'm going to be your student nurse today. I'm going to be administering your heparin infusion. I'm just going to take a look at your wristband, okay? So Wendy Holmes is my patient, as it says here, Wendy Holmes. And she is 35 years old. Her FIN is 1, 2, 3, 4, 5, 6, 7, 8, 9. 1, 2, 3, 4, 5, 6, 7, 8, 9. I'm going to get her to tell me her name. Can you tell me your name and your birth date? And it matches this. So now I'm going to look at my MAR, my order, to my heparin that's hanging. So heparin is my drug. Heparin here. 25,000 units for a final concentration of 100 units per ml, which is what I have here. And for my order, I'm going to be giving, starting it at 1350 units an hour, so I'll have to program that into the pump. This bag is not expired, and I've noted that the tubing is primed already, and it's also hanging with normal saline, which I checked in the monograph is compatible. And I also checked in the monograph earlier that the rate is within safe limits. So, noting that this is not expired, it's running via gravity rate, so I'll just confirm the rate by counting the drops per minute. But for video purposes, I'm not going to do that. So I've calculated, since I have to administer this at 1350 units an hour, my rate will be 13.5 mLs an hour, so that's what I'll be programming into my pump. So I've done my first check. I'm going to press colleague guardian. And it is for heparin venous thromboembolism because my patient has a DVT. So I'm going to go down to heparin VTE right here and press select. My drug amount is 25,000 units, and that's what's in my bag here. A diluent volume in 250 ml, which it is right here. My concentration is 100 units per ml, which I've already noted up here. And my dose, as on my order, is 1350 units an hour. 1350, and that is within state limits. And then I calculated that my rate is 13.5, so that's 1350 divided by my final concentration of 100. And that is correct. So I'm going to confirm, and I'm going to set this all up now. So, I'm noting that my Y site is already here, but I'm just going to prime it to be safe. And alcohol swab for 30 seconds and let it dry for 15. Make sure my clamps are open, my line is patent, okay? And now I'll be, if I can open it. Okay, my hands are a little wet. This would not be sterile. Okay, so I would swab this just to be safe. And now I can connect my lines. But I'm not going to start it yet. I'm going to make sure my clamp is closed. And I'm going to get a second nurse to come check. I'm going to do my second check first. So I'm comparing my patient again, Wendy Holmes, her FIN, her birth date, and all matches, and she's going to tell me again just to be safe. My medication is heparin is what I have, and it's for VTE, and that's what I programmed into the pump as well. The dose that was ordered was 1350 units an hour, and that's what I programmed here to get a rate of 13.5 mLs an hour. My final concentration is 100, and that's what I have here in this bag. And it is to start now, and the time is right. And my previous nurse has also date and time this label, so it's ready to go. So now I would get the second nurse to come do an independent double check to make sure that everything is safe, everything matches, the rate is correct. And I'm just going to do a little patient education. So my patient is receiving heparin because she has a DVT, so we want to make sure that it doesn't further clot and she doesn't have a embolism or something. So some risks you might experience with this medication are easily bruising or excessive bleeding. So just let me know if you experience any of those. So now that and I'm also knowing she has the right to refuse the medication if she wishes, but she doesn't want to. So I've checked my rights, I've primed my lines. I'm going to start my infusion now. Start. Going to open my lines and make sure I'm watching for 3 drops. And this is going at the correct drip rate. So it's flowing. I would make sure that I document that I gave the medication and who the other nurse was that did their checks. And I would be sure to monitor my patient, you know, tell her that she gets regular blood work and monitor for any signs of bleeding. I think that's everything. So now I'm going to move on to my chest tube. So with chest tube patients, there are certain safety checks you have to do when you enter their room. So I'm going to show you. My patient's order for suction was to be on low, and it is on low already, so I know that her suction is good. I'm going to follow her suction tubing all the way down to the drainage device over here. Making sure that there's no dependent loops or anything, there's no clots, and it's below my patient's chest cavity and it's flat on the ground. So I'm noting how much drainage there is, the characteristics of the drainage, and I would mark where it is at the beginning of my shift and assess it regularly throughout. I'm also noting what the suction control is at right now, so it's ordered to be at 20 centimeters of H2O, and that's where it is. I'm also noting, making sure that my tubes are going to my patient and to suction. And I'm also noting my my air leak chamber here, noting if there's the titling, which is normal because titling is when the volume moves with breathing. And then if there's any excessive bubbling, that means that there's an air leak somewhere, but I don't see any bubbling, so that's good. So now we're going to make sure the other part of our safety check is making sure that there are 2 clamps at the bedside or with the patient at all times in case there was an air leak. So I'm just going to position my patient now. Get your arm up here. I'm going to position you semi-Fowlers here. Wherever they're over here. Okay. So. Alright. So now I will expose the chest tube site. I've done hand hygiene, so I'm just gonna put some gloves on now. Okay. I'm going to first assess kind of outside the dressing what the site is like. Assessing for any subcutaneous emphysema because that indicates that there could be a leak somewhere into the chest cavity, but it feels good. I'm noting the color if there's any excessive drainage leaking through the dressing, but there isn't, and it looks good. So I'm gonna go ahead and set up my tray and then change the dressing. And I'm going to be using no-touch sterile technique. You can use sterile, but I'm going to use this one. Don't kick the drainage system. I don't really... Ooh.
I feel resistance, so I hit my application, so now I'm actively functioning.
Okay. I don't really need this, so I'm just going to place it here. And grab my garbage bag. Put this here. Still good. And I'm going to add my drain gauze. And my Gelinette, or adaptic dressing, which is going to go around the chest tube. If I can get it.
Since the second nurse have done my paper,
that part's not sterile anymore, so I won't use that. I'm gonna add my normal saline now. So now I'm ready to take the old dressing off and clean. Kind of stabilizing the chest tube while you take off the dressing. It wouldn't be this sticky on a real person. And my bed is already at waist height, but if it wasn't, I would make sure that it was before I started. Being careful not to touch the site with my gloves. Alright. That's garbage, and these are garbage, just because they're super sticky. Okay. So, I'm going to just kind of assess the site to see if there's any redness or excessive drainage. I'm going to use my blue forceps to take off the old adaptic dressing. And those are garbage too. So now I'm going to clean my site after assessing it with some 2x2s and normal saline. I'm just going to move this over. Let's squeeze that. Going in just circles around the drain, one swipe per wipe. I might even use a 4x4 to cover a bigger surface area, but to get closer to the tube, I'm just going to use the 2x2s.
Hi, Mr. G from Morden. My name is Angelica. I'll be your nurse.
And I might do one more.
We've talked about earlier. I have explained the procedure to the patient, and he already gave his consent. We acknowledge the patient has the right to refuse, but we've already got his consent. And we can
Okay,
proceed with the
and
procedure.
I'm going to clean the tube,
First, I'm just
actually,
gonna check
too.
here with that.
And then I'll dry.
Since the patient is already in semi-towel position, we can clean with the
The tube isn't normally stitched into the patient, so you don't have to worry about cleaning underneath. But now that it's clean, I'm going to dry it with a 4x4.
And the PIN number is 1234878. So I've got my identifiers there, so I've ensured that I have the right patient.
And one more.
Okay, now I'm going to start doing my safety checks. First, we're going to turn on suction.
Okay,
Okay, so that rolled.
that's dry. So now I'm going to place my adaptic dressing.
Make sure the suction is between 80 to 120. I'll put it at 100. I'm gonna check by putting
Come
the
on.
thumb
There we go.
That's too high.
And you want to kind of place it so it's like tight enough so that there's no air leaks, but not too tight, and you want it flattened down, just like that. So now I'm going to place my drain sponges. Make sure one goes
Put it at 100 right now.
one way, like that,
For the sake of the video, I'm just gonna.
and the other one goes a different way. Okay, and now I'll take one 4x4 and put it over top of everything.
Inside the glove. Just clean and not contaminate it.
And I would be putting cloth tapes over it.
The hand sanitize, and
I would ask a second nurse to go get me some cloth tape, and she can go do that now. Thanks. buddy nurse.
No problem.
So I will make sure I put my date time on here first because I don't want to write on my patient.
Cuff pressure is already checked as well, and I can bag and change it to times.
And I would just cloth over here. And I want this dressing to be fully occlusive so that there's no air getting in. So there's one
We
side.
will also check the medication bottle, make sure that we have it in the correct setting.
Making sure that I tent it over the tubing.
40% humidification. We should be at 40%, and it says 40 indicates the amount of oxygen that we need. So it has to be just oxygen.
And this is date labeled and timed. And then I would document about the dressing change, if there's any, drainage, excessive drainage, signs of infection. I would put my patient back to waist height and how they were before. Her arm is low. Okay. And I would also document the heparin infusion. And when her next dressing change is due, I
I
will
will
lower her
also
bed
be
lever with her call bell.
because the patient can take 2 to 3